do is I would collect all my supplies and bring them to the room. So I would have my trach care kit, my hydrogen peroxide, and my normal saline bottle. I would bring the supplies in the room, enter the room, introduce myself, perform hand hygiene. I would put on gloves. I'm just going to verbalize that I would have clean gloves on currently. Introduce myself. Hi, my name is Mary Thornburg. I'm going to be your nurse for today. I would explain the procedure. Before I would explain the procedure, I would verify the patient. Can you please state your name and date of birth? The date of birth and name matches the patient's armband as well as the MAR. I would explain the procedure. Today we are going to be doing some trach care. This is where we're going to be removing your reusable trach, cleaning it off, getting rid of any dried secretions. If at any time you are experiencing respiratory distress or discomfort, please give me a sign and we can stop for a minute and recollect ourselves. Are you currently in any pain? The patient is not in any pain. If they were, I would administer a pain medication before we begin the procedure. Now I will get the patient's bed prepared. Make sure it's at a good height for body mechanics and raise the head of the bed to a 45-degree angle because the patient is awake and alert. If the patient was not awake, then we would we can keep them in a lateral position. We would also make sure that we had suction ready in the room for if at any time we needed it. Look at this. All right, now we will assess respirations, the respiratory status. The first thing we're going to do is we're going to listen to lung sounds. Making sure to get the lobes. Then we would place an SpO2 monitor on the patient's fingers. That way we can monitor the O2 levels throughout the entire procedure, as well as we would count respirations. So making sure everything is within normal limits, everything is good here. Now that we have assessed everything, we are going to prepare our field. So we would open up the tray. I would take my sterile gloves and place them to the sides. Then I would get my little mat out, making sure to stay on the outer edges of the paper, placing the shiny side down. Once we've done that, we are going to dump the contents into the mat. Before I would get this, first we would make sure we can remove the O2 from the patient if they were on any. Next, we will take the saline, making sure to avoid the sterile field. This is a new bottle of saline. If it wasn't, then we would lift the bottle. We're going to pour saline into each of the containers. Again, going around. Then we take the hydrogen peroxide, only place it in the back portion of the container, as we need a 50-50 solution of the hydrogen peroxide and the normal saline as to clean the trach. Now that we have done this with my clean gloves, I can stabilize the trach and remove it, place it into the saline. Once we've done that, we can remove the gauze, take it and throw it away. Now, while that is sitting in the hydrogen peroxide and normal saline, we will get our sterile gloves. And open them up. Once I've opened them, I can take off my clean gloves. So I take them off, throw them away, and now we will place the sterile gloves on. A little difficulty, that's okay. We can readjust once we get the other ones on. Making sure to keep sterile. Right, now that we have the sterile gloves on, we'll take this, throw it away, and we will now go into the sterile field. Take our gauze and everything that we need out. We will take the brush, remove the inner portion of the trach, scrub the inside of it, outside, all around. We can now throw this away. We'll just place this aside, and we will place this into one of the normal saline compartments. Now that we've done that, assess, respiratory is good. There are no secretions that need to be suctioned, so that is good. We will now take the inner portion out, place it onto a normal gauze pad to dry off. Everything is still looking good. Patient is not in any distress or pain. We'll now take the inner portion. This hand will now become a clean hand, as well as this one will become a sterile. So with my non-dominant clean hand, I will stabilize the trach, place the portion into the trach, and lock it into place. Now with the sterile hand, I will take one of the cotton swabs, dip it into the normal saline, make sure to clean around the trach, throw away, sterile hand again, taking the swab into the normal saline, and cleaning around yet again. This, throw away. Now that we have done this, we can take our perforated gauze and place it, while we're stabilized, place it underneath the trach collar. Making sure to assess the patient's O2 levels. Everything is stable. Place this underneath the collar, and there we go. So now that has been placed, everything is good there. Now we can take the patient's new collar, and we will feed it through the loops while keeping the old collar in place, so that way we can we'll keep the old collar in place so everything is stabilized while we are applying the new collar. So, this, try and fold it. This is a little tricky with the gloves. I will do my best to keep everything stable. This, tie it into the end here. Then if we can have the patient lift up their head, wrap it around, and tie it onto the other side. Make sure it is comfortable for the patient, not too tight, but tight enough to make sure everything remains stable. There we go. Now that that has been tied on, we can remove the old one. Patient's O2 is still good. Now we can remove this one. Now that that has been removed, we can place the patient back on, we can take this, throw it away, and now we can place the patient back onto their oxygen if need be. I will change my gloves, throw these away, perform hand hygiene, put on a new pair of gloves. So now I have clean gloves on. I will reassess the patient's respiratory, so making sure to listen to the lung sounds, all of the fields, each of the lobes. O2 levels are good according to the SpO2 monitor, as well as respirations, counting them, they are within normal limits. Patient is not in any respiratory distress or pain. We would clean up our area, make sure the patient is in a low level, make sure they do not need anything, have the call light within reach, and that everything that they need is also within their reach to prevent any falls. Place the bed in the lowest setting, as well as make sure the side rails are up. We would take all of our supplies, throw them away, and then remove gloves, perform hand hygiene, and make sure that everything is taken care of with the patient and that they do not need anything else.